I'm Angela Serig, occupational therapist at Brigham and Women's Faulkner Hospital. Myself and the physical therapist here treat patients who have trouble regaining flexibility or strength after breast surgery. Today we'll talk about safe, early range of motion exercises you can do at home after surgery, as well as other common concerns patients have about physical rehabilitation.
What can I do when I return home after surgery?
Pace yourself. Take pain medications for comfort during your range of motion exercises, light daily activities, and for sleeping. Immediately after surgery, it's good to use your affected arm normally for light activities like brushing your teeth, washing your face, drinking from a cup, or preparing a light meal. Do try to avoid lifting anything heavier than 8 pounds, which is about the weight of a gallon of milk, for a month if you've had a mastectomy or tissue expander reconstruction, and for about 6 weeks if you've had a tram flap or lat flap breast reconstruction.
Are there exercises I can do at home after surgery?
In the handouts you will receive from the Breast Center, safe range of motion exercises are outlined. Pictures of these exercises are also available online. If you stay overnight at the hospital, a physical therapist will usually review the exercises with you before discharge. Beginning 1 to 2 days after surgery, try to perform each exercise 5 to 10 times, 2 or 3 times a day. The first exercise is the shoulder roll. Raise your shoulders up towards your ears, then roll them back and down. Try to squeeze your shoulder blades together gently as you bring your shoulders down. The next exercise is the shoulder walk-up. Stand in front of a wall and slowly climb up with your fingertips until you feel a stretch in the shoulder. Hold for 3 seconds, then lower your arm and repeat. You can also turn to the side and perform the same exercise for a slightly different stretch. If you had breast reconstruction and you have drains in place, walk your fingertips up only until your hand is shoulder height, until the drains are removed. The next exercise is shoulder external rotation. Begin with your elbows bent, squeeze your shoulder blades together, and rotate your arms away from your body as far as you can. If you've had breast reconstruction, check with your surgeon before attempting the next 3 exercises. To do the arm saw exercise, start with both elbows bent, pull your arms back further, squeezing your shoulder blades at the same time. Hold for a few seconds. In the back scratch, reach behind you with the affected arm, try to bring your hand to the middle of your lower back, then slide it up towards your shoulder blades. The final exercise is the butterfly. Place your hands with interlaced fingers behind your head, elbows facing forward. Then gently bring your elbows out to the side as far as you can.
When can I return to my normal activities?
It all depends on the type of surgery you had and your activities. Once your pain is under control, try returning to your normal activities. Just be sure you avoid any forceful activity or lifting more than 8 pounds for 4 to 6 weeks after your surgery. If you're in doubt, talk to your surgeon. Immediately after surgery, you should walk. Walking, or any exercise that elevates the heart rate and strengthens muscles, will help reduce fatigue, nausea, and joint pain often associated with cancer treatments. It also increases your energy level, elevates your mood, and reduces your risk of developing lymphedema. Plus, studies have shown moderate exercise, such as walking for 30 minutes, 3 times per week, can prevent second cancers among survivors.
What is lymphedema and how can I prevent it?
Lymphedema is the accumulation of fluid that causes swelling in the hand and/or the arm. We know that a small percentage of patients who have an axillary lymph node dissection are at risk of developing lymphedema. The good news is there are ways to reduce your risk. Details about risk reduction strategies can be found in the handouts you will receive. If you notice swelling in your arms or hands, contact your physician. Physical and occupational therapists specifically trained to treat lymphedema can help you manage the symptoms.
Should I have physical therapy after surgery?
If you have trouble regaining range of motion or strength, or returning to activities you enjoy, you might need to schedule a few sessions with a physical or occupational therapist. Talk to your physician for a referral.